Hello and welcome. You're watching Medically Speaking NewsX, and I am Pragati Singh. In the previous episodes, we have discussed about various topics of breast cancer, ranging from early diagnosis, screening, modalities, risk factors, and lifestyle changes. But on the other hand, breast cancer is a large subject that receives little attention. Therefore, we will today discuss some more details of the topic and hence try to dispel as many myths as possible. And ultimately, as our main aim is, we will try to spread as much awareness as possible. Without much delay, I would like to welcome our special guest, Dr. Geeta, Kadyapath, Senior Consultant, Breast Cancer, Max Hospital. I would ask my first question, starting from the question each homemaker would have in mind, and it becomes really necessary to put this question forward as they make the largest part of the breast cancer affected population. When undergoing treatment for breast cancer, are the daily activities affected to any extent? And how can a patient take care of themselves during this time?
So during treatment depends upon what kind of treatment you're undergoing. If it is surgery, we would encourage patients to move out of their bed even 4 hours after surgery. We would encourage them to have fluids, and then subsequently they can have normal food also on the same day as surgery. And we encourage them to use the washroom. We don't restrict them on their beds. And the next day onwards, we institute a proper physiotherapy program to ensure that their arm on the side of surgery is able to move well. Those exercises are taught, and we encourage them to walk or sit around and not spend too much of time on the bed. So there are no real mobility issues, but it's up to the patient to ensure that she gets off the bed and starts moving around, because staying in bed is not a good thing at all, because we're very worried about things like clotting happening in the veins of the legs, which can be quite a difficult problem to treat and can sometimes be very, very difficult, because if the clot moves into the lungs, then we are headed for trouble. So moving around is an absolute yes. Other than that, what can you do after surgery is something that one should know, that you can possibly do everything which is within range, and that is you can go ahead and do a few things inside the house, like doing dusting, or possibly even stirring things in the kitchen, or maybe cutting some vegetables. There's really nothing to stop you. But then sometimes, most of the times after surgery, you can have a drain pipe which is hanging by the side, and it can restrict a few of your activities, but otherwise it is not very restrictive. And then when you talk about chemotherapy, of course, you tend to be fatigued most of the time. Patients can have a bit of nausea. They may be having distaste for food. So basically, it may be an uncomfortable situation, and you may not be able to function optimally. But I think it depends entirely on the patient, how much she's willing to push herself, because we know of patients who get their chemotherapy, stay home for 3-4 days, and then go back to their occupation, which could be teaching, or it could be an office desk work. They go back to it, but it entirely depends on you, because there are another set of patients who just stay at home throughout the course of chemotherapy. And then if you talk about radiation is pretty much coming and going. You come, you are there in the hospital for about an hour. The entire radiation takes about 20-25 minutes. And then you go back home, and you can function pretty normally after radiation also. So what I'm trying to, drive home is that try and treat yourself as normal. Don't think that, because you've got this disease and because you're undergoing treatment, you have to limit yourself in several ways. You can actually function pretty close to normal if you choose to.
Is radiation necessary after lumpectomy? If yes, why?
So when we do a lumpectomy for breast cancer, so breast cancer surgery does not always mean a breast removal. So in suitable cases, we would offer a breast conservation surgery wherein you conserve the breast. But this conservation has to be followed by radiation. Only then does it become equal to a breast removal. So why is radiation mandatory after a breast lump excision? Is because the chances of local recurrence of the disease coming back in the breast can be as high as 30% if you were to not give radiation to the rest of the breast. So basically what radiation is doing, it is protecting the rest of the breast, and by giving a boost to the point, to the side from where the lump was removed, you are actually reducing the chances of recurrence in the breast.
Okay, ma'am. You just said there are two main types of surgeries. Yes, mastectomy and lumpectomy. When we talk about lumpectomy, also known as the breast conservation surgery, what are the chances that the cancer will come back after treatment? What are the chances of the reoccurrence?
So if you look at both mastectomy and conservation surgery followed by radiation, like I said, it is equivalent in terms of recurrence. But then, like I said, you have to be very selective about the patients that you use it in. It is not as if you cannot do it in big lumps. You can do it in big lumps, but that happens only after you have downsized the tumor with chemotherapy to make it amenable to breast conservation surgery. So the risk of recurrence is pretty much similar when you're at 5 years. So as if I were to say it is about 5 to 6% risk at 5 years, at 10 years, the risk goes up slightly. And in the breast conservation group, you may see a slightly higher risk as compared to mastectomy. But all in all, breast conservation surgery with radiation, the recurrence rates are pretty much similar to what you would see after a mastectomy. And in terms of long-term survival, there has been a recent paper which says that patients who have a breast conservative surgery tend to live longer, meaning the overall survival is better in the breast conservation group as compared to the mastectomy group.
What are the most common side effects of the radiation therapy, chemotherapy, basically the treatment modalities including surgery, and how long does it take for someone to recover from these side effects?
So if you look at surgery, you cannot call it side effects really, but what can happen after surgery is you may have flap necrosis if there is a mastectomy, or for that matter, even after breast conservation, sometimes the wound can give you some problems. There could be infection at that site. You could have a seroma. Seroma is fluid collection, which you see especially after a mastectomy, which happens in about 60 to 70% of patients. So it is a sequelae of the surgery, but it settles down over a period of time. So these are the short-term complications or sequelae of surgery. And the long-term complication of surgery, especially if you've undergone an axillary nodal dissection, meaning you've got all the lymph nodes in the armpit removed, is lymphedema. Lymphedema means the arm swelling up on the side of surgery. But to decrease the incidence of lymphedema, we do a procedure called sentinel lymph node biopsy in early breast cancer. In that case, if you do a sentinel node biopsy, the risk of arm swelling up is less than 6%. But if you were to do an axillary dissection, the risk of arm swelling up in the future is close to 20 to 25%. So lymphedema is the thing that you don't want to see, and it can happen anytime during your lifetime. It can happen after 2 months of surgery. It can happen even 20 years after surgery. But this is a sequelae of the surgery that we do. So this is one of those things. And then shoulder dysfunction, abnormal sensations or numbness in the upper arm, again, is associated with axillary lymph nodal dissection, meaning removing all the lymph nodes from the armpit. That's about surgery. With chemotherapy, of course, again, there can be side effects like there could be, nausea, vomiting. There could be hair loss, something that women don't like very much. Obviously, nobody would like to lose their hair, but that is a side effect of treatment. But these are all temporary side effects, and the hair will come back. Then there can be things like bone marrow depression, and there could be fatigue, which is very understated, and the patient doesn't feel up to doing things. So one must realize that chemotherapy does not recognize the good cells from the bad cells. They only recognize rapidly dividing cells. So the hair follicle, the lining of your digestive tract, the bone marrow, these are areas where there is rapid division of cells, and that is why you have the side effects that are associated with chemotherapy. And as far as radiation is concerned, radiation is a local treatment. It is basically consolidating on what you've achieved with surgery. So radiation, the local side effects could be hyperpigmentation in the area of the radiation. There could be sometimes some amount of skin peeling can happen. Uh, Other than that, and the skin peeling and all that settles within a month of stopping of radiation. Then there could be some amount of pain at the time of swallowing, because however much you try to avoid, the food pipe can come in the way of radiation and give rise to painful swallowing. Again, all these do settle down with medication. So for both the side effects of chemotherapy and radiation, there are some very good medication which can take care of all these side effects, and the patient is not very uncomfortable while undergoing these treatments.
Okay, ma'am. So far, we have known that all lumps are not cancerous, but they can develop into cancerous nodes if ignored. Is it so, ma'am? What are the various types of non-cancerous breast cancer, and what are the risk factors they carry? What is the cure to such benign breast conditions, ma'am?
So, when you get a lump in the breast, the important thing to understand is if it is a lump of recent origin, you need to get it investigated. You need to go and see a doctor. And this age criteria that, it's only women over the age of 50 or 60 who would get breast cancer is not completely true, because we see about close to 14% of patients under the age of 40. So for any age group, I would say if you were to see a lump, you must get it investigated. Having said that, if you're younger, if you're in the 20 to 30 or the 30 to 40 age group, 8 out of 10 lumps would be benign. Benign means non-cancerous. So how do you determine that you're part of the 8 or you're part of the 2? And that is possible only and only with investigation. So you have to meet a doctor. You have to do an imaging. If you're under the age of 40, you would be doing an ultrasound. You would be doing an ultrasound-guided needle biopsy to establish that this is benign or malignant. So if it is benign, and if it is really small, you can keep an eye on it, especially if you're under the age of 40, and possibly keep you on follow-up and possibly do another imaging, say 1 year down the line or 6 months down the line, if you think it is needs to be observed closely. And if there is any increase in size, then of course, surgery would be advised for solid lumps. Benign lumps can be solid, benign lumps can be cystic. When I say cystic, it means fluid-filled lumps. So if it is a solid lump and it is growing in size, then you need to get that out. But only after a biopsy, because there is a condition called phyllodes tumor, which can mimic a fibroadenoma. But the only way to know whether it is a fibroadenoma or a phyllodes tumor can happen only after you have removed that lump and then subjected it to pathology. There is a slight difference in the kind of surgery that is done for fibroadenoma and the phyllodes. For a fibroadenoma, you would do surgery, which is just some simple excision of the lump. And for a phyllodes tumor, you would do a wider excision with normal breast tissue for margins. So that is how you would treat that lump. But if it is a cyst, you don't need to undergo surgery. Cysts are fluid-filled, they come and they go. And this fact that benign tumors go on to become cancer, that's not true. But if that benign lump is, or that lump is not subjected to histopathology or a pathological examination, then you may miss some important information, because lumps could be precancerous also. And if you have not made an attempt to find that out, then if you get a lump again, you would think, oh, why did I get this lump when I got it excised? But the fact is that we have lost some information on the lump that was removed, and it was always meant to come back. So that is the thing one must understand. So if you're getting a lump removed for some reason, then that lump should be subjected to pathological examination. And that benign lumps become cancer is not true at all.
I wish I could extend this conversation, but since we are running short of time, what would be your sign of message to the viewers, ma'am?
My only simple message, especially in this month of breast cancer awareness, is that one should be breast aware. You should be familiar with your breast. You must learn the technique of breast self-examination. And once you're familiar with your breast, you would pick up an abnormality sooner than later. And if you do pick up an abnormality, don't hesitate to go to the doctor and get it sorted out, because that is what is going to make a difference between a good outcome and a poor outcome.
Thank you for the positive message, ma'am. Hope it spread awareness and positivity among patients. Thank you for talking with us, and for more such videos, subscribe to our YouTube channel. Follow us on Facebook, Twitter, Instagram. Link in description, and visit our website www.medicallyspeaking.in. Thank you for watching.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.